know there's a lot of things going on in the world, and we tend to focus on the issues that are taking place right now, but let's not forget to focus on your health. We got to focus on our health. Mental health is very crucial, and I hope that this song encourages you today. Lost touch with my soul. I had nowhere to turn. I had nowhere to go. Lost sight of my dream. Thought it would be the end of me. I thought I'd never make it through. I had no hope to hold on to. I thought I would break. I didn't know my own strength, and I crashed down and I tumbled, but I did not crumble. I got through all the pain. I didn't know my own strength, survived my darkest hour. My faith kept me alive. Pick myself back up, hold my head up high. I was not built to break. I didn't know my own strength.
Hi, I want to thank you for joining me today for the Texas Legislative Black Caucus Summit and panel on Our Health, Dispelling the Myths. I am honored to have the opportunity to moderate this panel. You all are in for a real treat because we have some of my favorite Texas House members today as panelists, and I can't wait to introduce them to you, and you all get to hear from them. First, I would like to introduce myself. I'm State Representative Retta Andrews Bowers, and I represent Texas House District 113, which is located in East Dallas, and that includes parts of Rowlett, Garland, Mesquite, Dallas, Balk Springs, Sunnyvale, Seagoville, and Combine, which I get to say quite a bit, but I love all my cities. This is my sophomore term serving in the Texas House, and I serve as the Secretary of the Texas Legislative Black Caucus. When I was asked to put this panel together, I chose the topic, Our Health, Dispelling the Myths, because there is so much misinformation going around about health care practices and policies. I thought this could be a great forum to dispel some of those myths and talk about some of the work members are doing this session to improve our health care and access to it in Texas. I want to first start off with one of my favorites. He happens to be my next door neighbor in the Capitol this session. That's State Representative Dr. Tom Oliverson. He has the pleasure of representing my home city that I grew up in, Houston, an area that I still love and have not been home this year, Dr. Oliverson. Wow. I haven't, not yet. So I look forward to getting back there. But Dr. Tom Oliverson is a practicing anesthesiologist and a partner in U.S. Anesthesia Partners, the largest anesthesiology group in Texas with over 1,100 anesthesia providers. A tireless advocate for patients and their safety, Dr. Oliverson, that I affectionately call Dr. O, is recognized as an expert in office-based anesthesia and consults with doctors and dentists throughout the state in order to make office surgery safer for patients. Dr. O, he's been here since 2017 in the Texas House, and again, he's a chairman of the Texas House Committee on Insurance and serves on the Public Health and House Administration Committees. Dr. O, welcome.
Thank you, Representative Bowers. I appreciate the opportunity to be with you all today.
Well, it's
good to see my next door neighbor.
Absolutely. And finally getting a chance to talk.
Yeah.
You know, we pass each other in the hallway. Mm-hmm. We're on the floor. This is a busy time for us. So I appreciate you taking the time. And so your first question today, let's just move on into it.
Yeah.
Dr. Oliverson, can you tell us about the COVID-19 vaccine and why it is so important for everyone to get it as soon as it's your turn? And the second part of that question, is the vaccine safe?
Sure.
Is one vaccine better than the others, or better for a certain population than others?
Those are great questions. So I would say that, yes, everybody should be vaccinated. And the reason is because we know that even if you get sick with the virus and survive the virus, which the vast majority of people do, that there can be significant, potentially lifelong chronic, residual problems that go along with that. There's this group of folks, and we like to call them, they're affectionately called long haulers. And these are the folks that get sick and then they recover, but they don't ever get back to 100%, or at least as far as we know. So the beautiful thing about the vaccine is that it's not like getting infected with the virus. The vaccine causes your body to make only one of probably 36 proteins that are necessary to build a virus. Think of them like Lego building blocks or something like that. But that one block is the one that your body, when the virus gets in your body, will recognize as being an invader and attack and destroy it. So at no point when you get the vaccine are you ever infected with the virus. So it is much, much safer to get the vaccine than it is to get the disease. And the other thing that we know is that some of the mutations in the virus, you may have been hearing about that there are some different strains now that are coming out from different parts of the world and such. And what we know is that some of these newer strains are actually more deadly than the original strain that came to our shores in the early part of last year.
Sure.
So strongly encourage everybody to get vaccinated. It's a safe, you asked about effectiveness. They're all highly effective.
Okay.
I would say that one of the good things about the FDA process and the way that we've manufactured these vaccines, they are very safe to begin with, because like I said, this isn't like the polio virus vaccine where you're getting exposed to the virus itself. So they're very safe. And I don't know that, so I had the Pfizer vaccine. I don't know if you had the...
That's what I was going to say. I'm trying not to cut you off, but I am a survivor as well as having had Pfizer. So,
Gotcha.
So like, I'm hoping I checked out clear. But there was a point that I thought I was a long hauler. I was really worried about that. And I had to have EKGs, had to go through all that checkup, but I cleared out fine. So what about, and I'm sure I'm not alone, so what about the patient like myself that is a survivor of COVID and has now had is vaccinated?
Yeah, I don't know, and this is one of those things about vaccines in general that's kind of hard. It's relatively quick for us to get a good indication of safety. And then the second thing that we sort of can figure out is it effective? But what's much harder for us to know, to know is sort of the long-term immunity effects and how, some populations where perhaps somebody got the virus like yourself, then got the vaccine. Do you have better immunity than I do?
That's what
because I didn't get the virus, but I got the vaccine. Do you have different immunity, or how does that work? Those kind of questions, we can't really know the answers for those for probably a couple of years to come.
Wow, Dr. Oliverson, thank you so very much. That's so much information and necessary for right now. And I feel like when it's their turn, people will go out and get that vaccine, and that's what the hope is. I think we're getting somewhere. Well, thank you all so much. We are now joined by my esteemed colleague, Representative Shawn Thierry, and she is the first and only woman elected to House District 146, the district that would have made her my representative. So I'm so glad to have her. She authored 57 bills on a wide range of issues, including public health, economic development, anti-human trafficking, mental health, public education, and many more. This session, Rep. Theory was appointed to the influential committees, the Powerful Ways and Means Committee, where she will lead as vice chair, and the Land and Resource Management Committee. On a personal note, Rep. Theory is the mother of an 8-year-old daughter and has practiced for 25 years. Your first.
Thank you for having me.
Absolutely. It's an honor to have this time with you. And as I said to Dr. Oliverson, we don't get this time to chat much. And so it's great to have you on the couch. And I promise you that this will be easy for you.
Thank you. But it is, I want to say, a little point of personal privilege. It is certainly a pleasure and my privilege to join both of my esteemed colleagues. And we appreciate all the work that you are doing, Representative Bowers, to promote wellness and health in our communities and just throughout the state of Texas.
Sure, and thank you for that. I mean, it's just, Dr. O, you won't know this, but, Representative Theory and I grew up in the neighborhood together at different times. I a little bit older than her and ahead of her, but, so it's a great honor to be able to serve alongside her and to have her serve my home community.
And just a little fun fact. Both of our mothers went to Texas Southern University together and pledged the Delta Sigma Theta sorority, and I believe Retta's mom pledged my mom in the sorority.
Yes,
Wow.
yes. There's all little tidbits, all those tidbits.
Full circle.
It does. So let's get on to your first question and move forward. You have filed numerous bills this session to help women get better health care coverage. Thank you for that. And specifically Medicaid eligibility after a pregnancy. We know you as the champion for maternal mortality and Medicaid coverage of doula services. Can you tell us about those bills and any other health care bills that you're working on this session?
Sure. Thank you so much. I guess I'll start with just a little bit of background for those that may not be aware, but I know my colleagues know, but a few sessions ago, I found out that unfortunately Texas had an extremely high maternal mortality and morbidity rate. That's a mouthful, as you know, but what that essentially meant is that women in Texas were dying at higher rates during or shortly thereafter after childbirth, or they were also having higher rates of disease related from pregnancy. So when I read the report, I was very shocked to hear that. But then there was another statistic that at the time was a little bit more like a footnote, which was concerning to me, and it was that African American moms were dying at 3 times the rate of all of our counterparts. And so that really shook me, and it took me back to a place where, took me back to when I delivered my daughter back in 2012, and I had almost lost my life. And so that really just kind of became the impetus for me to start ringing the alarm, sounding the alarm, and doing the work. And from there, I started to file legislation that would require the state of Texas to look into that, to do research on what was causing these disparities in the rates. And so I'm very proud that it became a big bipartisan effort with folks like Dr. Oliverson. We came in together, the same class, freshman class, and Governor Abbott put this issue on the special session call after I wrote him a letter, and we ended up passing legislation during a special session to address this issue. So fast forward, another session came around, and we did some of the work, but it wasn't done. So now here we are in my third session, and what I have several bills. One is to, I guess I'll talk on the global level, is to re-establish an Office of Health Equity. And so for many years, different times in the legislature, we've had an office that, looked at healthcare disparities, but we lost the funding for it. So HB 202 will re-up that funding, and it pivots to exactly what we've been talking about, even as it relates to COVID. So it's not just maternal mortality, it's issues like COVID, it's heart disease, it's diabetes, it's all of these illnesses where we see that there are healthcare disparities, and they're not always on the racial lines. There's healthcare disparities for people that live in a rural community.
Yes.
You know, they don't have access to doctors as often. So what this bill would do would create that Office of Health Equity, fund it, and allow essentially a clearinghouse where all this data that we collect, they will be the hub for that. And so then they can recommend the best practices. The doula bill is really neat. I just got through doing a one-pager today saying we love doulas, and it got lots of traction in the Human Services Committee. And it really just, these are for women that are already on Medicaid. So if anybody's listening and you get a little weirded out by the word Medicaid, this is for people that are already in the program. It just would allow them to have that coverage.
Sure.
And so we know the data shows that women who have doulas have healthier pregnancies, which leads to healthier babies. So we are getting some support from pro-life groups and what have you, because it's all about, you can't have a healthy baby if you don't have a healthy mom.
Sure.
So I've got that bill, and then there's one other I'd like to just talk about briefly, and that's HB 136. It's a continuation of the work. It will establish a work group, the first statewide data registry where we can put all of this data for maternal mortality and morbidity. And so once again, if we don't have anywhere to receive this information in real time, we can't make the recommendations that we need quick enough.
Awesome. Well, wonderful. Thank you. And so, Representative Theory, thank you for all the great work that you're doing on maternal mortality and for sure doula services for all women. There's so many great things and great bills that have been filed this 87th legislative session that really affect our community and will impact members in our community and people of color for years to come and generations. And so that brings me back to some of the things that we've already talked about with Dr. Oliverson. You and I have had the chance on occasion to talk about bills that you've filed that affect women and surely black women and people of color. So if you will share at this moment some of those bills that you're working on, and you know, I have to say that we've got brilliance in this room and I am grateful. So I definitely want to hear from you and to let black people in Texas hear about some of the work that's being done.
Absolutely. So I think one of the first ones that we heard in the Public Health Committee that I filed, which I think we actually uncovered something that maybe a lot of folks didn't know, had to do with bone marrow donation and the availability of donors. And so I filed a bill that would basically make it easier for people to become bone marrow donors by promoting awareness, you know, when they go to the driver's license office, making sure that it's easy to sign up. It's not a painful or complicated procedure to become registered to be a donor. And what we found out in the testimony is that for communities of color, particularly for African Americans, the chances of finding a successful match if you need a transplant drops from about 80% down to about 1 in 4, about 25%. And that's just simply because there are just not enough African Americans that have actually registered to be donors. And it's a very specific thing. So different ethnic groups and national origins and backgrounds and stuff like that, all that matters when you're talking about something like a match for bone marrow.
Sure. And so it just means for all of us that we've got our work cut out for us, and we have to really be advocates for people, black people in Texas. So thank you for that, and thank you for along the way those conversations in the hall, those conversations in the chamber that really are bringing a lot of good legislation to light. Thank you for the work that you do. And we are now joined by the esteemed chairwoman of the Texas Legislative Black Caucus, and that is Chairwoman Nicole Collier. And as I mentioned, the brilliance that we have on this panel that I am so happy to present to you today. Chairwoman Collier represents House District 95 in Tarrant County, and she is the first woman to represent that seat. She has just began her fourth term. fifth term in office and was once again named chairwoman of the powerful Criminal Jurisprudence Committee. Breaking another boundary, she was the first woman in Texas history to serve in that capacity. So thank you for being with us today, Chair Collier. And you serve in public health, right?
Absolutely, yes. Thank you so much for allowing me to be here. I appreciate to be with my colleagues.
There are so many bills that have been filed this 87th legislative session that really do affect our community. And as chair of the TLBC, the Texas Legislative Black Caucus this session, what are some of the bills you're hearing?
Well, thank you so much. We're hearing some really good bills. Of course, we've got the champion for maternal health, Representative Sean Theory. And you know what? Dr. Oliverson is being a champion as well. You know, he talked about the bill dealing with bone marrow. One of the things that I really appreciated him as a practitioner, he's able to talk about what he's seeing on the ground and then translate that into positive legislation that can have a good impact in our community and communities across Texas. And so one of the things when you were laying out that bill, you identified the lack of African Americans who participate. And you know, that stems back to the Tuskegee Institute experiment where individuals were given syphilis. And so, you know, Black people have had a reluctance to participate in the healthcare process, especially when you're talking about something experimental. And so we're seeing that with the COVID-19 vaccine. But one thing I do want people to realize is that there was an African-American doctor that was involved in creating and crafting and developing at the National Institute of Health the Moderna vaccine. But going back to what you were talking about the bone marrow, you know, I want people to understand what the importance of bone marrow is in the delivery of healthcare.
Sure. Yeah, that's I should have said that. So the reason that's important is because the ability to receive a bone marrow transplant is how we cure certain kinds of cancers like leukemias and lymphomas. And so that may be that person's only way to be cancer-free is if they can get a transplant, and it pretty much cures the cancer. So it really is life-saving treatment.
Absolutely. And so it's important that with his bill that would provide education, and a lot of times it is about education, but it's also about access. We have to have access to quality foods. You know, when we have too many food deserts out there, it's hard for us to have a healthy lifestyle. And so that's another issue that the Texas Legislative Black Caucus is working on, is access to economic development within our communities that can bring in, you know, more opportunities for funding. So
just laid out a bill for that last week in my committee. You talked about ways and means.
Explain that for me, please.
Sure, that's the tax committee. And so we talked about the bill just addresses the fact that Texas overall has the largest what we call grocery gap in the state in the United States. And so what this bill would do is a creative way of using our tax code to create economic development. So it incentivizes businesses to construct grocery stores in areas that meet the definition of a food desert by allowing them to take a 5% franchise tax credit. And so it's permissive, you don't have to do it, but it's another tool in the tool chest. So if a company is coming in and they said, you know, we thought about going in that area, well, now I have this 5% franchise tax credit, you can add it to your other franchise tax credits, and then so it's a win-win for business, economic development, and as Chairwoman Collier said, for our communities. Seniors and children right now have the largest amount of food insecurity rates in the state of Texas.
Right.
That's excellent.
And so I remember going to a conference, I went to a healthcare conference, and they talked about what you should do if you don't have access. You know, what is the next best thing to fresh fruits and vegetables? Well, they said frozen. And then they said, if you can't get frozen, use canned. And so, you know, we've got to retrain our brains. I mean, I love me some smothered pork chops or, you know, some smothered chicken.
Absolutely.
But I can do it in a different method, especially with that air fryer that we've got.
Well, we have to learn some new ways of cooking, I think, in our communities. And to have you here, well, Chair Collier, your time bringing us all together in what we've talked about earlier in the segment. But then, Dr. O, you know, we really do, because as Chair Collier said, she loves that smothered pork chops and chicken. And I certainly have to leave fried chicken alone and steak at that. So.
I try to eat more fish when I'm here. My rule here at the Capitol is always have salad, try to have fish, never have dessert. And so that kind of my little secret. But going back to what Chair Collier said, so, I think one of the things, and Senator Nathan Johnson and I filed legislation on this that would create a pilot program within the Medicaid program to look at the social determinants of health, because what medical researchers are realizing is that having medications or having access to a doctor is important, but having food insecurity, housing insecurity, not feeling safe at home, these are issues that may have as much or a greater impact on a person's overall health than what, being able to get your blood pressure checked regularly or stuff. Not to say that that's not important.
Sure. Yeah.
It's just that what we put into our bodies, where we live and how safe we are in the environment in which we live, that those things matter.
Absolutely.
And we need to wake up to the fact that, especially within Black communities in Texas, that I feel, at least as a doctor, like we got some inequity problems with respect to these social determinants that need to be addressed.
Absolutely.
Dr. Oliverson, we saw, and Representative Bowers, we saw when I was doing the research for the grocery gap food desert bill, that there are even disparities in just if you have to go to a corner store to get milk. We saw that the price was double for the same product than at the grocery store. And so that's another way then that you have less access to buy healthy foods, because you have less money because you've just been charged twice the price through no fault of your own.
Right.
And so even the smothered pork chops are better than hot Cheetos and all the other things that are there. So some people literally, there are communities, as I said, it's in urban communities, it's in rural communities where there's just a small population of people. When they go to the store, they have very, very limited options. So I'm so glad that you're addressing that inequity. I really appreciate that.
Thank you all. And there's just one other area that I want to touch on with Rep Theory, with the Affordable Health Care Act and the special enrollment period. If we could hear about that, the Affordable Health Care Act is having a special enrollment period that we all know that started on February 15th that goes through May 15th. And I think Dr. Oliverson talked about awareness. And so we want to make sure that our people know what's going on. Make sure they know to sign up. You talked about them registering, Dr. Oliverson. So, Rep Theory, where can people sign up for health care or change an existing plan? And can you tell us where to do that and why it is important for all of us to have health care coverage? I think that will sum up what we've talked about here today.
Absolutely. So I guess I'll start with the why, and then I'll start with the how or the where, as you stated, Representative Bowers. So I always, when I go out and I speak about health, I use this mantra. I say our health is our wealth.
All right.
It is truly our wealth, because none of it matters if you're not well. And so, unfortunately, Texas is still number one in the number of uninsured residents in the state of Texas. So those are some real substantial reasons why everyone needs to have some access to our health care plan. We know that the emergency room is not the best place to get your treatment. So if you have health care insurance, you can do some of the things that Dr. Oliverson and Chairwoman Collier are talking about in terms of prevention. So that you don't end up with a lengthy hospital stay, or you don't end up finding out about an illness that's almost at a point where it's too late to correct or cure. So as you pointed out, right now is enrollment time. So I've got a card. It might read backwards on the camera, so I'm going to take the time to read it. It's for ACA enrollment. It's www.healthcare.gov. I like to say, just click the link, healthcare.gov. And the number, if you're not into all of that, you can still call it is the old-fashioned way, but it's the way, 1-800-318-2596. 1-800-318-2596, 24 hours a day, 7 days a week. There's always someone there to get you enrolled.
Well, thank you so very much, and we'll make sure that we share that information. I was going to ask you to repeat it, but I should have known that you would have already taken care of that. And so, as I said, it's a delight not only to serve alongside the three of you in the Texas House and our colleagues. It is an honor to serve. I thank each of you for your service. Y'all got here before I did. I got here as soon as I could, as my dad would say, and he was a doctor in Houston, here in the state of Texas for almost 40 years. And so what an honor to be the moderator of the healthcare panel on Our Health, Dispelling the Myths. So I want to give a sincere thank you to all of you today. We are starting to enter a heavy part of session with long committee hearings that we are all going back to and work on the floor beginning. And we are honored to serve you all at home. I appreciate all of you taking the time out of your busy schedules today to be here and share this information, this important information about the important issues that face our communities.
Thank you.
Thank you.
Thank you.